Next, we'll hear from Moller, the director of the Louisiana Budget Project.
Hi, thank you for letting me be here. Just wanted to talk a little bit about the numbers. As you know, this would definitely be good for overall health, as Dr. Cerise said. But we also, at the Budget Project, think it would be good for Louisiana's budget. But first, I wanted to talk about a study we did last fall, and we wanted to see who is actually going to benefit from this. I mean, I think it's important to note that most of the people who would be covered by this expansion are people who work, but they just don't make enough money to afford health insurance, or they get insurance offered by their families, by their employers, and they just can't afford it, or it's not good insurance. So, I mean, if you're making under 133% of poverty, as you heard, you're not making a lot. And so we wanted to know who are these workers, where are they working, what kind of jobs they're doing. And so we crunched some census numbers, and we came up with some numbers. 35,608 people work in restaurants and food service. People, waiters, waitresses, dishwashers, people, bartenders. Another 26,000 plus work in construction. They work in department stores, they work in grocery stores, they work in nursing homes and hospitals. They work in elementary and secondary schools. They work in child daycare centers. They take care of our kids. They work in hotels and motels. These are people who work hard, most of them full-time, and they just don't have insurance. If they get Medicaid, they're probably going to be better workers, because if you have a Medicaid card, you can go see a doctor when you get sick, and you don't have to sit all day in an emergency room. So this is, in many ways, a pro-business proposition for the state, because you're going to have, it's just going to be easier, and you're going to go back to work faster when you get sick. You're going to be more likely to get treated for a chronic illness, and there's going to be less absenteeism. So that's one thing. The other thing I want to bring up is these cost estimates. We've heard, the first estimate we heard from this administration was that Medicaid expansion was going to cost $3.7 billion to the state over 10 years. They're not even pretending that that number is real anymore. They're now relying on this number that we got from the Kaiser Family Foundation that says, well, it's going to cost a little over $1 billion over 10 years. That's still a big figure, even though it's just $100 million a year. But we actually don't think that that number is accurate either. And as Dr. Cerise hinted at, we think it's going to be close to a break-even proposition, because what these cost figures don't account for is the numbers, the money that the state is going to save. You know, right now, when somebody goes into an LSU hospital, they are paid, their care is funded by what's called disproportionate share hospital funding. That's a section of the Medicaid that that covers the uninsured, and about 60% of that is federal, and about 40% of that is state general fund that taxpayers put up. When we cover more people, there are going to be fewer uninsured people going into the charity hospitals, and so we're essentially replacing 60-40 federal state funding with this Medicaid expansion is 90% funded, well, it's 100% funded by the federal government for the first 3 years. So for 3 years, it's absolutely cost-free to the state. But even after that, when the state has to start putting in money, it's never going to be more than 10 cents on the dollar. So we are actually replacing essentially 40 cents on the dollar healthcare spending with 10 cents on the dollar healthcare spending. And when you crunch the numbers, we think it comes out to a close to a break-even proposition. There's also certain care right now in the system that the state pays for 100% federal funds. For example, prisoner care. When someone at Angola gets sick and they need to go to a hospital, 100% of that hospital care is right now funded by the state. But under expansion, these prisoners are going to be eligible for Medicaid. So the federal government is going to be picking up 90% of the care of our prisoners. There's other parts of the Medicaid program that are funded by state dollars right now that the federal government is going to pick up. So when you hear that this is $100 million or $1 billion cost to the state, we simply don't think that's true. And even, you know, not only is it a good deal for public health, but it's a good deal for the state fisc in the long run. So.